I'd like to introduce Dr. Suzanne Chang. She is Professor Neurological Surgery at the University of California, San Francisco. Dr. Chang has a major research focus on the development of novel therapies for patients, as well as the assessment of novel imaging markers of prognosis and response to therapy. Dr. Chang has also created novel clinical programs such as the Murray Neuro-Oncology Caregiver program and the Sheri Sobrato Brisson Brain Tumor Survivorship program, both developed to enhance the care of patients and families. Today, Dr. Suzanne will talk about survivorship, surviving, thriving, and living well. Just give me 1 second as I share the slides.
I would like to thank the organizers for inviting me to give this talk on surviving, thriving, and living well, supporting our patients through the brain tumor journey. According to the U.S. National Cancer Institute in 2018, an individual is considered a cancer survivor from the time of diagnosis through the balance of his or her life. And we know that family members, friends, and caregivers are also impacted and are therefore included in this definition. This commentary in JNCI on developing a quality of cancer survivorship care framework has implications in terms of clinical care research and policy. This group identified not only the various factors that can affect the ability of patients to have a good quality of life, but also outlined the specific areas of healthcare delivery that need to be addressed. Now, we know that brain cancer survivors constitute a vulnerable population with distinct and complex medical, psychosocial, emotional, and cognitive needs, and that these needs can change throughout the disease journey and negatively impact the quality of life. And general cancer survivorship resources often fall short in meeting the unique needs of brain cancer survivors, but efforts such as the creation of a neuro-oncology survivorship care plan are now emerging to address this. And these are important communication tools to help foster and share better understanding of follow-up care after active treatment. They also provide recommendations to help anticipate future needs as it pertains to the longitudinal aspects of care. So we wanted to basically form a survivorship program to support our patients. And our efforts started with listening to the patient. We heard patients express issues with adapting to their new normal, coping with lingering side effects and symptoms, role changes, disruption of family systems, fear of cancer's recurrence, social isolation, and a search for renewed meaning, purpose, and hope. Yet many also voiced a deep gratitude and appreciation for their life, as well as a desire to give back while they still could. What we really heard was that although survivors were continuing to live, they really were not thriving. And thus the survivorship program responded to these issues by providing an array of holistic, patient-centered services to help empower survivors to be the healthiest version of themselves. We felt that this was important, sort of as acting as a bridge to make sure that patients moved from surviving to thriving. So the mission of the Sheri Sobrato Brisson Brain Cancer Survivorship Program is to enhance the wellness and quality of life of patients with brain tumors through a collaborative, multidimensional approach focusing on emotional, physical, and cognitive health. We really focused on two questions. What does it mean to live a great life with brain cancer? And how can we support our patients in doing so? We're very fortunate to have an amazing team of core members. So myself, Naomi Hoffer, who's an amazing program manager, and Lex Greenstein, who is a RN and nurse practitioner, to help coordinate all of the resources for our patients. We have amazing collaborators that extend from social work, exercise physiologists, integrative oncology. This is where we're looking at other types of care for patients like nutrition and alternative medicines to integrate with standard of care. And then we have important subspecialty physicians, including those in neuropsychology. So these were the pillars that we felt to provide the patients with the best individualized survivorship care possible. And the pillars will briefly describe over the next few slides. As I said, this survivorship program really includes key pillars of cognitive care, workout for wellness, or WOW, some events and classes, living well resources, and peer support and community. So for the cognitive care clinic, we wanted to have a personalized, holistic, patient-centered cognitive care with comprehensive consultation and management as it relates to quality of life. And some of the things we incorporated included not only cognitive testing, but also education and resource linkage, return to work intervention, caregiver training, goal setting, and legacy projects, which really was allowing the patient to have a voice as to their life and meaning so that their families can have this. We again wanted to make sure that we personalize this to our patients. And this is a metric of how many patients we have actually helped over the last 2 years. So you can see the types of efforts that the team is providing in terms of testing and screening and caregiver training, as well as resource linkage. We also have a component of cognitive research led by Jenny Taylor and Chris Jamora-Wire. And this is where we are looking at intervening with assessing the feasibility of cognitive rehabilitation in patients with stable low-grade glioma, where we're collecting preliminary efficacy data on various intervention. There's also a longitudinal arm where we are following newly diagnosed patients prospectively to identify timing of clinically meaningful cognitive change, try to correlate that with tumor characteristics and imaging parameters. So our workout for wellness is really important. We've seen more and more evidence that exercise not only helps with a sense of well-being, but also allows patients to improve on symptoms like fatigue and sleep. So we offer one-to-one exercise counseling to assess the individual goals and assess resources to create this individualized program. And we also have reduced or complimentary memberships at participating facilities. We are working on a new app that really focuses on patients who have difficulty with balance or weakness and may need to be either in a chair or in bed so that we can ensure that these patients still have an exercise program tailored to their current level of functioning. For the events and classes, this is something that we felt was important in terms of providing education. So we have a series of Living Well webinars that are held once a month, and they always include a survivor voice, so there's meaning to these various topics. And there is an after the show segment for community building. And all of these are actually recorded in our video library. And these include numerous topics such as relationship resilience, strategies for coping with cognitive changes, thriving as a young adult, neuroplasticity in the human brain. These videos are free and available on our website, and we add them every month to the program. We also started an Integrative Approaches class series with Donald Abrams, who's an internationally known integrative oncologist. And this sessions include group instruction as well as individual consultation on cancer nutrition, plant therapies, and non-traditional medicine for cognition and fatigue. We usually have about 7 to 10 patients for every class, and we also encourage care partners to attend. This is something that we have found to be very, very well received by our patients and the families. So talking about our handouts and resources, we have developed as a single issue informational sheets on various topics related to cognitive strategies, emotional health, diet and exercise, traveling, mindfulness, and we continue to develop these as needed, with translating them also into other languages such as Spanish, and also will be accessible online and as a manual. One of the things we've heard from our patients is the sense of isolation, and that unless someone has been a brain tumor survivor, they really don't understand what they're going through. And so we felt that this sense of isolation needed to be addressed. We have this ability to have peer support and community building and connection with these support programs. So we have a peer support volunteers that are trained to provide comfort and practical information. And we have a weekly Thrivers group so that these peer support volunteers can get the advantage of coaching tools and one-to-one connections. We also have a brain tumor support group and also communicate with a Thriver newsletter. So in summary, this is very important in terms of having a patient-centered approach, which is one of the things I love about this particular session, is that we're really keeping the patient at the center of everything that we do. So if we think about developing a survivorship program, we need to make sure we recognize the patient needs across the trajectory of the illness, to garner support, to build a program and team, to provide opportunities for support and resources exploring electronic-based practices. And this is something we've learned in the COVID pandemic, is that we can transition a lot of this into these virtual meetings, which really alleviates the difficulty with access to a lot of our resources. So we've had amazing attendance at our meetings. We were holding these in person at first, and we would have maybe 10 or 12 people attend. However, now with the webinars that we've developed, we can have up to 60 people attend. So that's amazing. We also need to address sustainability in any program that we develop. So wanted to talk about how we approach things at UCSF in terms of really integrating clinical care, basic science, clinical trials. These are all the things that are really going to push the field forward in terms of new discoveries for effective therapies. However, we need to keep this in mind in terms of supportive care services that span both the patient and the caregiver. And so I think that the ability for us to provide cutting edge care and quality care is really key to moving forward with how we take care of our patients. So we have an integrated and comprehensive supportive care program at UCSF. As I mentioned, this really centers on the patient and the clinical care of the patient. So we really integrate these programs, the survivorship program, social work, palliative care, and our caregiver program, all to improving the quality of survivorship for our patients. So I'd like to thank you for your attention, and also to thank the generous supporters of the Gordon Murray Caregiver Program and the Sheri Sobrato Brisson Survivorship Program. Thank you.
Great. Thank you so much, Dr. Suzanne. This was extremely insightful, and especially for new brain tumor foundations like our own. I feel that this is almost like a North Star for us to be able to have a separate patient survivorship program and a separate caregiver program. Of course, right now we just do it all in one, but that really for me would be the North Star. Thank you so much.